Vital signs part 3. Blood pressure. Blood pressure is the force exerted against the walls in the arteries. The systolic equals the contraction of the heart, where the blood pressure rises and the blood moves out of the heart and into the vessels. Diastolic equals relaxation, which is the lower number. This is the blood pressure when the heart is filling and there is no blood moving through the arteries. Blood pressure. Normal blood pressure is under 120/80. Pre-hypertension is considered 120/80 to 139/89. Hypertension stage 1 is 140/90 to 159/99. Hypertension stage 2 is 160/100 and above. Children are oftentimes lower. Newborn blood pressure is 60 to 96 systolic and 30 to 62 diastolic. Children 1 to 3 years old are 78 to 112 systolic and 48 to 78 diastolic. Children 4 to 6 years old are 78 to 112 systolic and 50 to 79 diastolic. 7 to 11 years old children are 85 to 114 systolic and 52 to 79 diastolic. Adolescents are 94 to 119 systolic and 58 to 79 diastolic. What affects blood pressure? So blood volume, how much we drink during the day. Diameter of blood vessels. Sometimes the diabetics will have a narrower lumen of blood vessel. Therefore, their blood pressure may be higher. Heart muscle. Vessel elasticity. As we age, our vessels become more brittle and stiff. Age. Activity, sex, so if we're male or female, our stress level, other diseases, like I mentioned before, and sometimes medications will affect our blood pressure. Types of sphygmomanometers, so most of the time we have a dial or clock type. Even though they don't contain mercury anymore, they used to many years ago, we still document the blood pressure in millimeters per mercury. Blood pressure is always recorded in increments of 2. So if you give me an odd number for a systolic or a diastolic, that will be incorrect, and you will have to redo your blood pressure test out. So blood pressures are always 120, 122, 124. They are always even numbers. Guidelines for stethoscopes. So earpieces should face forward. So when you look at your stethoscopes, they will be bent slightly one way, and you will want to make sure that your earpieces are slightly bent towards your eyes because your ear canal is not completely straight. You want to use gentle pressure and put a good seal on the patient. A lot of times, many people do not press hard enough and are not able to hear that blood pressure, so don't be able to put some pretty good force on that. A lot of times patients cannot feel that. The bell of the stethoscope is what we place on our patient. It is actually the smaller piece here. The diaphragm, if you look in this picture, is pointing to the diaphragm, the earpieces, and then you have the tubing. This is a single tube, and then there are some double tubes, and some people prefer one over the other, and it's just based on personal preference. Taking the blood pressure, make sure arm is supported and is at the same level of the heart, as you can see in the picture here. Palm should be up. Clothing should be removed or pushed up. We never take blood pressures over clothing, despite what you may have seen in the clinic at your own visits. Use appropriate cuff size. So pediatrics, we oftentimes use pediatrics obviously on a pediatric patient, but also our elderly ladies that are really tiny, we will sometimes use a pediatric cuff. A large adult cuff for those adults who have a little bit larger upper arm. An adult cuff is a regular size cuff that most people use. And then there is a thigh cuff, which is quite a bit larger than what our adult cuff would be. So taking the blood pressure, we palpate the brachial artery. We find where we need to listen and place that bell. A lot of times people will place their bell in the exact middle of the arm, and they might not be even close to that brachial artery, and they won't be able to hear that blood pressure. So being able to find that brachial artery and then placing the diaphragm of your blood pressure stethoscope over that brachial artery, so slightly off to the side. So if you place your diaphragm right here, you will be able to listen to it and hear it quite loudly. If you have it over here, you might miss it completely. Apply the cuff with the center over the brachial artery and 1 inch above the antecubital space. The bladder of the cuff should cover at least 3/4 of the arm. You want to keep the blood pressure cuff. Oftentimes I tell students to hold the end of the cuff with your non-dominant hand and then practice bringing with your dominant hand the remainder of the cuff around the patient and then securing it that way. And we will show you that technique in class. You want to close the control valve and then righty-tighty, lefty-loosey. Just got to remember those rules when closing the valve. Taking a palpatory blood pressure first, and the reason why we do this is to get a ballpark figure of patient systolic blood pressure. Gives you the amount to pump up the cuff to. It decreases errors with auscultatory gap. So what you will do is you will palpate the radial artery, inflate the cuff, and note the level where the pulse cannot be felt anymore. You then deflate the cuff completely and wait 15 seconds to do the next step in your blood pressure. You place the stethoscope in your ears. Some people will tap the stethoscope to make sure it's turned on. You will feel for a brachial artery again, and then put the bell or the diaphragm over the artery, making a good seal. You want to make sure the valve is then closed. Inflate the cuff 30 millimeters of mercury over the palpatory blood pressure that you just got. Deflate the cuff slowly and listen for the first sounds. You should deflate the cuff about 2 to 3 millimeters of mercury per second. Continue to listen and deflate the cuff and listening for when there is no sound, and that would be the diastolic. The sounds are often called the Korthoff sounds. We note numbers and what arm was used, and oftentimes we will write that on a piece of scrap paper, and then we will enter it into the electronic medical record. You will then at this point remove the cuff from the patient. Pulse pressure equals, so how we get the pulse pressure is we take the systolic pressure minus the diastolic. The larger the number, will possibly indicate atherosclerosis or cardiovascular incident. So a blood pressure that is 120 over 80, the pulse pressure would then be figured as 40. 40 is the average pulse pressure. Palpatory method. So palpatory method of taking a blood pressure. In rare cases, there are some instances where we absolutely cannot hear the blood pressure in a patient. We've tried several times. We've had a couple of different people try and take that blood pressure, and nobody is able to hear it. So what we would do is we would do the palpatory method. The systolic pressure can be palpated. So we place the cuff in its normal position, palpate the radial artery, inflate the cuff until the pulse disappears, and then what we do from there is we add 30 millimeters of mercury more of inflation. We keep the fingers placed over the radial pulse and we slowly release the pressure of the cuff. We watch the gauge and record the first pulse felt as the systolic reading. We will then record that number over P. So for instance, we felt the pulse come back at 120. It would be 120 over P. In our electronic medical records, they do not let us sometimes enter a alpha letter, such as P, so we would put 120 over 0, and then we would just notify the physician that was palpated. So what are some instances that we do not take blood pressures in certain arms? So if a patient has paralysis or a stroke on one side, we would not take a blood pressure. We would not take a blood pressure in arms with IVs or recent venipunctures, especially if they are on anticoagulation therapy such as Coumadin or Lovenox. Dialysis shunts, mastectomies on that side, particularly because of lymphedema, or if there is pain or injury or there's a cast or a break in that arm, we would not take the blood pressure in those arms. We would find somewhere else. If a patient has an IV in both arms, we would then probably go to a blood pressure in the thigh. And to take a lower extremity blood pressure, as you can see how we wrapped the thigh blood pressure cuff over this person's thigh, you would then place the bell of your, or diaphragm of your stethoscope over the popliteal pulse, which is in the back of the knee. So you want to feel for that pulse, and then that's where you would place your bell or diaphragm. If we can't get a thigh cuff around the leg, or there is some reason why we cannot use the thigh, we would then go to the posterior tibial pulse, and we would wrap the cuff just above the ankle and then place the bell or diaphragm over the posterior tibial artery just above the ankle to hear that blood pressure. You also might want to check with your physician to make sure this is okay. Some physicians do not like lower extremity blood pressures. So oftentimes you might want to check with them when you first start working with them what their take is and what they would prefer in those instances. Errors in taking blood pressure, so the limb not being measured at the same level as the heart. So if we have a limb way below our heart, the rubber bladder was not completely deflated before starting. The pressure in the cuff is released too rapidly. The patient is nervous, uncomfortable, or anxious. A lot of times I like to call patients back from the waiting room. I like to go through allergies and medications and everything else, and I usually take the blood pressure last. And usually that's to build a rapport with the patients and help them relax a little bit. The patient drank coffee or smoked cigarettes within the last 30 minutes. The cuff is improperly applied. The cuff is too large or too small. So if a cuff is too large, the blood pressure might be decreased. If the cuff is too small, the blood pressure could be increased. The cuff is not placed around the arm smoothly. The bladder is not centered over the artery. In your blood pressure cuffs, you will have arrows, and you will want to line up your brachial artery with that arrow. The examiner did not wait 1 to 2 minutes between measurements, or there might be a defective instrument. Hypertension is sustained blood pressure over 140/90. Oftentimes, hypertension has no symptoms. We treat hypertension, but we never really cure it. So patients, once they are put on medications, they are on those medications long term. This is not a short-term fix. We oftentimes coach patients to decrease their stress level, lose weight, decrease their salt intake, increase their exercise, stop smoking, decrease their caffeine intake, and sometimes we will have to change up their meds or put them on medications to help. Hypotension is a low blood pressure, typically seen in patients with shock or hemorrhage. If this is not the case, some patients do have just a naturally low blood pressure, and oftentimes is not a problem unless there is dizziness or fainting or syncope. Postural hypertension, often called orthostatic hypotension, is when the blood pressure drops when going from lying to standing. Dizzy, faint, or blurred vision are often symptoms. It is often a symptom of dehydration or vertigo. We check the blood pressure lying, sitting, and standing. We'll have the patient lie down for 5 minutes, and then we take the blood pressure. After that blood pressure is taken, we will then have the patient stand immediately, stand for 1 minute, and then we take the blood pressure again. Have them stand for another minute, and then take the blood pressure again to see and compare those readings. A decrease in 20 millimeters of mercury systolic or 10 millimeters of mercury diastolic is an indication of orthostatic hypotension. So here is the mercury sphygmomanometer, and as you can see, this reading would be, here is the 160 mark, and each hash mark is 2. So hence why we only go by 2s, and we always have an even number. We never have an odd number. So here we have 160, 162, and this blood pressure would be 164. Okay. The next hash mark is 166, the next one is 168, and then we jump to the next big line, which is 170. This picture shows a blood pressure of, so this is 80, 82, 84, 86, so 86. This one would be 186. And then this one would be 52. This one we have 40 plus 8, so that would be 48.